Hey everyone, welcome back. So, we've covered what Oropouche virus is, how long it can stick around, and most importantly, how to prevent it. Now, let's address a question that naturally comes up. How do you treat Oropouche virus? And here's the thing about Oropouche and many other viral infections. There isn't a specific medicine, like an antiviral drug, that directly targets and cures the Oropouche virus itself. It's not like a bacterial infection where you can take an antibiotic. This is really important to understand, as it shapes how doctors approach treating someone who has Oropouche. Instead of a cure, the treatment for Oropouche virus focuses entirely on what we call supportive care. Think of it as helping your body get through the illness as comfortably as possible while your own immune system does the heavy lifting of fighting off the virus. So, what does supportive care look like? First and foremost, rest is incredibly important. Your body needs all its energy to combat the infection, so taking it easy and getting plenty of sleep allows your immune system to work efficiently. Next up, fluids. When you have a fever, and especially if you're experiencing any nausea or vomiting, it's really easy to get dehydrated. Drinking plenty of water, broths, and even rehydration solutions can help prevent dehydration and keep your body functioning properly. For those uncomfortable symptoms like fever, headaches, and muscle aches, over-the-counter pain relievers can be a big help. Medications like acetaminophen, often known as paracetamol, can help bring down a fever and ease those aches and pains. However, and this is a crucial point, it's generally advised to avoid aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen, especially if there's any chance you might have dengue fever instead of Oropouche, as these can increase the risk of bleeding in certain viral infections. Always check with a healthcare provider if you're unsure what to take. In most cases, Oropouche is a mild illness, and people recover fully at home with this kind of supportive care. However, if symptoms are severe, or if someone develops more serious complications like signs of meningitis or encephalitis, things like severe headache, confusion, or a stiff neck, then hospitalization might be necessary for closer monitoring and more intensive supportive treatment. The good news is that the vast majority of people who get Oropouche virus make a full recovery without any long-term problems. But because there's no specific cure, our best strategy remains prevention, avoiding those insect bites in the first place.